Henry Ford West Bloomfield Hospital is not only the #1 employer in the greater West Bloomfield area, they're also at the cutting edge of both medicine and technology, including with a brand new procedure recently approved by the FDA that they are the first in Michigan to utilize in order to treat severe peripheral artery disease. Joining us now on the program is one of the many doctors behind using this program in Henry Ford Health System. Joining us is Dr. Tamer Boules. He is the Vascular Services Director at Henry Ford West Bloomfield Hospital. Dr. Boules, thank you so much for joining us today.
Thank you for having me, Tyler.
Yeah, glad to have you on to talk about this incredible procedure that is really in its first stages of its life, and you at Henry Ford West Bloomfield Hospital, your team, the first in Michigan to use this system that's called Limflow system. It helps to treat peripheral artery disease. So before we go into the technicalities of this procedure, tell us a little bit about peripheral artery disease and how that does affect people that are afflicted with this condition.
Sure. Peripheral arterial disease is actually much more common than you can imagine. It affects at least 4 million people in the country, and that number is growing because the risk factors for peripheral arterial disease include things like diabetes and smoking and high cholesterol and high blood pressure, and even genetics, things that can, over many, many years, damage the arteries and reduce the blood flow to various parts of the body, including the legs, where the symptoms can creep up quite quickly as people are generally trying to stay pretty active. And in their most severe stages, can lead to limb-threatening problems where people can risk losing their leg if nothing's done about it.
And this is a disease that affects people in a number of different ways. It comes on in a number of different ways. And so you got to take, I would imagine, various approaches to treating that, which makes this new system, this new technology, Limflow system, that was recently approved by the FDA, something that really helps you treat particularly the more severe cases. Tell us a little bit about Limflow and how that helps you attack peripheral arterial disease, especially in those more severe cases.
Sure. So the Limflow procedure is a recent sort of modification of a procedure that's been around for several years, but has been recently engineered to have optimal conditions to improve blood flow to the lower extremities in a very novel way. It's used for patients that have no other conventional option for improving blood flow. Traditionally, we have been able to offer patients bypasses or angioplasties or stents or other procedures that are easily done as an outpatient or after a short hospital stay. And that is the way we treat most people with vascular disease. But there are some patients, maybe about 20% of those 4 or 5 million patients in the country, that can go on to really have no good option. And it's those patients that benefit from the potential of the Limflow procedure. The Limflow procedure is also known by another term called deep vein arterialization. And to summarize, it's a way to convert the veins that go usually drain the blood out of the foot and leg into arteries that can provide blood flow into the foot directly, sort of reversing direction and in many ways reversing their traditional job to be another option in patients that don't have any arteries in their foot that can receive a bypass or are amenable to the more traditional procedures and sometimes simpler procedures we do. So the Limflow procedure has been, in its clinical trials for several years. And in October, it received approval because of its great results in patients that have that very severe advanced level of peripheral arterial disease in the densely situated in the foot and lower legs. And so that's sort of the subset of patients that's always been the challenge for us to treat.
And so in terms of this versus what it's sort of been modified and advanced from, how does this approach, this Limflow approach, differ in both the results, maybe the expediency of the results from treating peripheral arterial disease, and make the patient outcomes maybe better or less intensive than they possibly would have been before?
Sure. So traditionally, if patients did not have access to this kind of procedure, at least half of them would not have their leg would suffer an amputation within about 6 months to a year. And we know that patients that have amputations actually can go on to have a higher chance of other complications, including death. And some of that reflects some of the blockages in arteries elsewhere in the body that can predispose to strokes and heart attacks, but some of it also reflects the complications and debility that comes along with having an amputation. So this procedure was designed to alter that course, and the early results suggest that instead of 50% or more of patients losing their leg at 6 months, at the end of a year, in the right patient, 75% or more were actually healing their wounds or sores on their feet from low blood flow, and had good functional status in their foot and are able to avoid amputation. So they've survived and were amputation free over the course of that year. And those studies are ongoing, but it was such a remarkable turnaround that the FDA approved this particular device, and it is now expanding its application, saving limbs around the country and so globally.
And as you said, Dr. Tamer Boules is with us on the Splash Live. He's the Director of Vascular Services at Henry Ford West Bloomfield Hospital. You can keep up to date on all of their advances on social media, Facebook at Henry Ford Health, and on their website at henryford.com. Dr. Boules, in the case of Henry Ford West Bloomfield Hospital, as you mentioned, this procedure approved by the FDA in October. Your hospital, the first in the state of Michigan to receive approval to perform this procedure. How did that come to be, where Henry Ford Health got in line first in the state of Michigan to start performing this at Henry Ford West Bloomfield Hospital?
That's a great question. Well, Henry Ford West Bloomfield is part of a bigger health system that includes several hospitals, and Henry Ford Health System in general has served as a, we call it a quaternary care center. It's a place that handles the most complex problems that typically smaller community hospitals frequently have challenges with, and they refer to bigger and bigger hospitals. And we are considered as a health system to be sort of the safety net for those patients that are the most complex. So when the developers of the Limflow procedure were looking to expand their options for these patients, they really wanted to go to places such as Henry Ford Health as a system where those patients get referred quite frequently with the most complex peripheral arterial disease as well. And Henry Ford West Bloomfield is fortunate to have many of the vascular capabilities necessary to take on this challenge. We've been expanding our vascular services over the last several years and are now doing a lot of other cutting edge things beyond Limflow in the world of peripheral arterial disease and blood clots in veins and procedures to prevent strokes and treat aneurysms. So it's only natural for our team here, which includes a lot of excellent multidisciplinary physicians, nurses, and folks in our angiography and interventional suites. It was really a natural fit for us to be the first to offer this here because there are many patients in this area, in the West Bloomfield area, and in southeastern Michigan that are being referred to us for consideration from this, even from other vascular surgeons that don't yet have access to this technology or have patients that are not making progress with the traditional therapies.
So as you've implemented this in Henry Ford West Bloomfield Hospital, as you've done these procedures since your recent approval as the first in the state of Michigan to perform Limflow in your hospital, what's that experience been like for those that are performing that versus other similar procedures that are more common to treat peripheral arterial disease?
Yeah. Well, because those other more common procedures have been tried in many of these patients already and have not worked, I think that the patients are counseled appropriately to understand that when they have the Limflow procedure or the deep vein arterialization procedure, it is a journey. It is not an instant fix. It requires close follow-up with our wound care team, which is excellent here at Henry Ford West Bloomfield, and close follow-up with regular imaging and ultrasounds to make sure that the stents we use for this particular procedure stay open. Again, we're converting a vein in the lower leg into an artery, and that involves a procedure where we extend a stent from inside a small artery into a vein. And all this is done incisionless. So it's a minimally invasive procedure, but despite its minimally invasive nature, it takes several weeks, if not even several months, for these veins to mature into arteries and change jobs. And so, these patients understand that it is a several-month journey that takes time, takes patience, and to be honest, many of them tell me, I don't have any other choice. My other choice is to face an amputation or chronic pain. And so they're more than willing to go through this rather than another, as you mentioned, more commonly applied procedure that frequently has already failed them.
You can learn more information about the procedures and the availability of services throughout the Henry Ford Health System on their website at henryford.com, or follow them on social media, including on Facebook at Henry Ford Health. Joining us is Dr. Tamer Boules. He is the Director of Vascular Services and the Section Chief at Henry Ford West Bloomfield Hospital, as they become the first in the state of Michigan approved to perform Limflow right here in West Bloomfield. And Doctor, we know that in our community we have a very diverse population from a number of different ethnic and cultural backgrounds. And we also know that in the cases of peripheral arterial disease and other similar diseases that affect the vascular system, that they do tend to have different effects on various communities, particularly on Black and Hispanic patients in particular. So how does having this procedure available at Henry Ford West Bloomfield Hospital better equip your team to treat a variety of different patients with a number of different risk factors?
Yeah, that's a great question, Tyler. So absolutely, peripheral arterial disease affects all ethnicities, across the board, but it does have a heightened prevalence in our Hispanic and African-American community. And some of that has to do with the higher prevalence of diabetes, among other risk factors in that population. And patients with diabetes, when they develop peripheral arterial disease, tend to have disease in their smaller arteries, in their lower legs and feet. And that is the hardest to treat. So with our very diverse and rich population in this area, richly diverse population in this area, we are hoping to make a significant impact for many of those patients that may not have as easy access to some of these advanced procedures if they lived elsewhere. We are getting referrals even from across the state, and so patients are traveling distances to potentially have the procedure, and that does go along with some challenges for follow-up, but we're working with various wound care centers across the state and trying to maximize our reach so that we can help as many people as possible.
And finally, Dr. Boules, given that you're at this point, you're treating people not only in our local area with a Limflow procedure, but those from, as you said, across the state. What are these next steps to continue to implement this more frequently in your health system to help others around the state that are looking to do the same, and continuing to implement new technologies and new procedures to better advance the care available at Henry Ford West Bloomfield Hospital?
Yeah. So, the next steps really involve getting the word out to referring physicians, podiatrists, patients about this option, because until they know it exists, they really, unfortunately, are isolated with just chronic pain and foot wounds that are quite debilitating and have their complications. So really getting the word out. And the goal is to get enough of an experience with this procedure that we can start to expand it to other hospitals in our health system, and working with industry is also expanding to other centers around the state and around the country, so that it can become available to you in hopefully your own neighborhood or your own region. That really kind of goes along with all of the services that we provide at Henry Ford West Bloomfield. It's really about an awareness that these services can be provided in your community, and that although previously some of the procedures we used to require advanced facilities such as what we have on the Detroit campus, now we're able to perform many of these procedures because we have access to not only the team that's capable of doing them, but also the equipment and the aftercare in our hospital that can handle these complex vascular problems. For example, over the last year, we've introduced several new procedures. We're performing carotid stenting in a way that is as safe as the surgical option, and that's a minimally invasive procedure. We're treating blood clots in veins that were very extensive, that would leave patients with a lot of long-term morbidities and swelling. We're treating them with procedures that can get them home within the next day or even be done as an outpatient. And we're treating more complex aortic aneurysms here at West Bloomfield that previously required, again, transfer to another hospital. So, the technology is really evolving quickly, and it's just a matter of getting the awareness out to our community that it's available here.
They're keeping on the cutting edge of both technology and medicine right here in our community at Henry Ford West Bloomfield Hospital, including in the Vascular Services Department, where we've been joined today by its director, Dr. Tamer Boules. Dr. Boules, thank you so much for your time.
Thank you for having me, Tyler. Really appreciate it.